Module 2, History of Nursing Theories and Nursing Science. Science is a method for describing, explaining, and predicting causes or outcomes of interventions. Being a scientific discipline means identifying nursing's unique knowledge for the care of patients, families, and communities. It means that nurses can conduct critical and basic nursing research to establish the scientific base for the care of individuals, families, communities, as well as populations. Nursing science is substantive, discipline-specific knowledge that focuses on the human universe health process. The goal of nursing science is to represent the nature of nursing, to understand it, explain it, and use it to benefit all of humankind. Philosophy attempts to discover knowledge and truth. It attempts to identify what is important and valuable. Assumptions are statements that describe concepts or connect to concepts that are factual, accepted as truths, and represent values, beliefs, or goals. Assumptions are taken for granted statements of the theory, the concept, or the research that occurred. When assumptions are challenged, they become propositions. Assumptions emanate from philosophy. They may not represent the shared beliefs of the discipline. Ontology is what is or what exists. Epistemology is ways of knowing the nature of truth, the relationship between knowledge and belief. Logic is considered a conclusion or a deduction. Ethics is moral philosophy. And aesthetics have to do with harmony, beauty, and the arts. A paradigm is an organizing framework that has concepts, theories, assumptions, beliefs, values, and principles that form the method a discipline interprets the subject matter of concern. Nursing is characterized by two predominant paradigms. It's generally accepted that multiple paradigms are indicative of a healthy scientific community and give different points of view. For rationalism, an example is that the reason that the lack of social support or the cause results in hospital readmissions or the effect. For interpretive, the formulation of nursing diagnoses. Formulating differential diagnoses requires collecting facts and devising a list of possible theories to explain those facts. Phenomenology describes how we experience the objects of the external world. It provides an explanation of how we construct objects of experiences. Empiricism is based on the idea that scientific knowledge can only be derived from sensory experiences. A broad concept that is included is neoliberalism. This is about the economic and privatization of healthcare in the United States, as well as health conceptualization as a profit and loss situation, and the patient is human capital in an expense account. Epistemology is the study of the theory of knowledge. Ontology is the study of being, what is and or what exists. Methodology means the acquiring of knowledge. The main purpose of developing knowledge is to improve the nursing practice. Empirics is a scientific form of knowing, involving observation, testing, and replication. Ethics is the knowledge of what is right and what is wrong. Personal is known as priori knowledge, knowledge that is gained from thought alone. Sociopolitical is knowledge dealing with the social factor as well as the political factor. Aesthetics is knowledge related to beauty, harmony, and expression. Emancipatory is a pattern of knowing that makes social and structural change possible. It is the ability to recognize barriers that create both unfair and unjust social conditions and to analyze complex elements of the socio-political context to change a situation. Epistemology is the study of the theory of knowledge, and ontology is the study of being and doing. The nurses being and doing. Developing these patterns of knowledge makes nursing its own discipline in science. It helps the profession to gain its own identity. And it also allows nurses to create their own language. Empirics is the received view or received knowledge. Individuals learn by being told or receiving knowledge. This focuses on understanding the parts of the whole in an attempt to understand the whole. Theories are made to describe, explain, and predict phenomena in nature and to provide an understanding of relationships between the phenomena. Empirical knowing strives to explain nature through hypothesis testing and the development of theory. Acceptable methods for knowledge generation of empirics are traditional experimental methods or the scientific method. When looking at the assessment of the scientific method or empirical knowing, how does it work? What does it do? What does this represent? What is the relationship between the dependent and the independent variable? Ethics is moral knowledge. This often occurs as a moral dilemma that arises in times of uncertainty and when consequences are difficult to predict. The aim of ethical knowledge is the evaluation of what is good, what is valuable, and what is desirable. This is the development of moral knowledge throughout the 1980s. Ethical knowledge is principles, codes, and ethical theories. This is based on the obligation to serve and respect human life. When we assess ethical knowledge, is it good? Is it right for all of society? Is this the responsible way to treat individuals? Personal knowledge, the way nurses view themselves and others. This is a subjective knowledge. It promotes wholeness and integrity in the nurse-patient relationship. The aim of personal knowledge is the idea of being with, of presence, of letting the person matter, and being open to help that person make meaning out of their experience. This is an essential feature of the nursing practice. Without the knowledge of personal self, this allows an openness to knowing another person. Nursing is only a technical assistance and not involved in care without understanding the personal self. This is the engagement with others. It involves open communication, centering, and actualizing of oneself. This involves empathy, active participation, and therapeutic communication. When assessing personal knowledge, what do I know? Do I know how to do it? Do I understand what I don't know? Aesthetic knowledge involves perception of others' thoughts, feelings, and understanding. Aesthetic knowledge is the creation of meaning and value. It is the synthesis of the abstract and the concrete. This is knowledge related to beauty, harmony, and expression. In the assessment of aesthetic knowledge, what does it mean? How is this significant? In the healthcare system, there are often unequal class structures, power relationships, as well as political and economic power-produced sexism, racism, ageism, and classism. This affects health and results in illness for the population. Nursing must address how domination affects the health of persons and communities. It must have understanding of gatekeeping mechanisms. All the other patterns of knowing need to be framed with the context of socio-political knowing. Advocacy for all of society, especially for those that cannot speak for themselves. For assessment, who can be heard? Who speak for the silent? Emancipatory knowledge. It's the identification of inequalities amongst the population in society. This is expressed as actions to change existing social structures and creating practices to change these social structures.